How to improve your overall health by improving your oral health. Part 2 coming up. Hi everyone, this is Dr. Ernesto from Attaboy Cowboy, and on this channel we give you health and wealth tips to help you be more successful. I'm going to share with you some additional tips on how to keep your mouth healthy and your overall health. First, let me go into some of the basics. I just had a patient the other day ask me, Doctor, why are we having so many issues with cavities when they say cavemen didn't have any issues? So I started researching, I read some research, and that is in fact true. They said most cavemen did not have cavities, or very little, because they primarily ate plants and very little meat. They weren't eating a lot of carbohydrates and sugars like we do now. Unfortunately, when we eat stuff like this, it tastes really good, or white bread or any of this other processed food, they add a lot of sugar to it. That sugar colonizes bacteria in your mouth that eat your teeth and cause cavities. So you want to try to avoid sugar, obviously, as much as possible, but that's why modern men and women end up with over 90% of them getting cavities in their lifetime. Now, what did the cavemen use to brush their teeth in those days? Well, a lot of them just used twigs. They'd get these twigs and they chew on them. I remember when I was in Ethiopia, they were giving these out everywhere to help people with hunger, but also to brush your teeth. You just chew on it and clean your mouth out. As people became more sophisticated, they'd grab the ash out of fires, they stick their fingers in it, and they brush their teeth with the ash, because ash is also really good for cleaning your teeth. In fact, you can buy activated charcoal, dip your toothbrush in it, and brush your teeth for whitening and for cleaning your mouth. That's natural, it's healthy, it's a good alternative to use. I typically just buy something like this, like charcoal toothpaste. That's what I use. I don't use anything with fluoride. Stay away from everything with fluoride. Fluoride is very toxic. Talk to any chemist, they'll tell you it's a very toxic substance. We started adding it to our toothpaste after World War II because a lot of people were having cavities and that was causing a lot of health issues. Basically, when we transitioned from being hunter-gatherers to farmers, we started growing more carbohydrates. That's when people started getting more cavities. So during World War II, the U.S. government wanted to keep people healthy so they can participate in the war, work in the factories, everything else. So they started putting fluoride in the water and in the dental products, and immediately caused an increase in life expectancy. So in that sense, it was good because people at that time weren't living as long, and they had other health issues like rotting teeth, which causes a lot of damage to your heart in particular and your overall health. Imagine just having rotting teeth, and every time you drink or eat something, you're introducing bad bacteria to your body. Very toxic for you. However, times have changed. Things are cleaner now. We don't have all these issues with cavities. We have a lot more know-how. So it's not really necessary anymore to use fluoride. At that point in time, it was probably a good strategy, but at this day and age, it's not worth it anymore. Now we know that it's very toxic, and we don't need that anymore. Just like many things that we used to do in the old days, we don't do anymore. My mom's house, we have an incinerator. When back in the 50s and 60s, people used to burn their trash. We don't do that anymore. It would cause a mess because of global warming. So we have to adapt. And fluoride is definitely not something you want to have in your diet. It's going to be in things naturally. Your body does need fluoride, and it's naturally occurring in different vegetables and things that you eat, teas. But you don't need to introduce additional with your mouthwashes or your rinses or your toothpaste. If you do use products with fluoride, it easily gets absorbed into your mouth. Inside the lining of your mouth, you have cells called simple squamous epithelial cells, and they're very thin, and they're basically for allowing diffusion. So when you eat something, they start to release fluids into your mouth like saliva, and they actually help with the digestion process, but they also allow for uptake of nutrients through your mouth. So the absorption already starts in your mouth. If you introduce something toxic to your system like fluoride, you're going to absorb it into your mouth, and look how far it is to your brain. It's only a few inches. It's going to go into your brain, and it gets concentrated. Your body stores it in your frontal cortex of your brain. That causes something called fluoridosis, which is an overconsumption of fluoride. That's why you don't want to use fluoride products with children, especially because they tend to swallow a lot of the products that they use, which causes brain damage. Now, what does that do exactly? Well, it damages your frontal cortex, and that's where your behavior and your personality comes from. If you ever look at that movie, One Flew Over the Cuckoo's Nest, you'll see Jack Nicholson at the end of the movie. I guess he was acting crazy, so they decided to give him a frontal lobotomy. That's where basically they get a hook, they pop it in through your nose, break into the nasal cavity here, into your sinuses, and they put it straight into your brain, and they scramble around, they damage your frontal cortex, kind of like an omelet. And if you look at that movie, he's still alive, but he's just sitting there like a zombie. So it makes you into a zombie. So prolonged exposure to doses of fluoride will actually make you more passive and damage your frontal cortex, which you don't want. So don't buy products with fluoride in them. It's not necessary anymore. Now, what types of products should you use? Well, let me go over what I recommend and what I use myself. First off, toothpaste. I just use plain old bar soap. Use the simplest, soap you could find. Natural soap is good. If you can, buy some ivory soap. This is just made out of animal fat, like beef tallow, which is like the fat when they slaughter the cows. There's no perfumes in it. There's no colorings. That's what you want. You don't want something like Ivory Spring that's dark green or dark blue, any of that. You don't want all those toxic dyes. That's going to get absorbed into your mouth, go into your brain. No perfumes, nothing. Now, I know that the idea of using beef fat sounds nasty, but that's what glycerin is. And that's what almost all toothpaste are made out of. They're made out of animal fat from slaughterhouses. So you can use toothpaste if you want, but you use something that's fluoride free. I sometimes use this one. This is a charcoal toothpaste, so it has charcoal added to the glycerin, and that's good for your mouth. Now, if you want to kick it up a notch, you want some whitening power, you can dip your toothbrush. Once you rub it on the soap, you just go like this. Rub it on the bar of soap, brush your teeth. If you want to kick it up a notch, get some baking soda. You can put your toothbrush in there and just dip it in the baking soda. Add that to your teeth every once in a while. Not all the time, so make your teeth really sensitive, but that helps with whitening. Now, what about mouthwashes? Well, mouthwashes, I use a recycled jar of mayonnaise or kimchi or whatever you have, and this is about 12 ounces. I put about 3 heaping tablespoons of baking soda. Now, if you put too much or too little, it doesn't matter. Baking soda is not going to hurt you. In fact, you can put extra baking soda if you want to help use it more as a whitener. But I use it to disinfect. So I usually rinse out my mouth for a few minutes before I brush my teeth. And to make it nice, I add a little bit of spearmint or peppermint drops in there. That gives it a nice odor, so that I can have a nice odor when I'm going to kiss someone or something like that. And I also add a few swigs of apple cider vinegar with Mother Natural. That also helps as a natural astringent to help kill bacteria. So I use this daily when I brush my teeth. Again, no colorants, like Listerine and stuff like that. Has way too much alcohol. That's actually bad for you. That can damage the simple squamous epithelial cells in your mouth, and it can cause cancer. So you don't want things with alcohol. Don't use products that have dyes, like dark blue or dark green, all that. It's all toxic. Just avoid all that. This is just plain tap water. Now, what type of toothbrush should you use? Any toothbrush is fine, but if you have a little extra money, you want to splurge, buy an electric toothbrush. I use these just because I tend to use too much pressure. That damages the enamel on your teeth. So this has a sensor on it that when you're pushing down too hard, it stops. It kind of tells you, okay, you're pushing too hard. So it helps with pressure. Especially as you get older, your enamel gets thinner, so you don't want to be pushing too hard on your teeth. That'll damage your teeth. So I recommend electric toothbrushes if you have that issue. Now, what about flossing? Well, I floss, but not very often, maybe a few times a week. I've looked at research. They say that some people think you don't need to floss, but most of the major American Dental Association, people like that, they recommend flossing. So if you like to floss, you can floss a few times a week or daily or a few times a week. It's up to you. I only do it a couple times a week. I've seen research that says you don't really need to floss that often. Now, what about keeping your teeth white? Well, don't use the fluoride rinses or any of that stuff for the same reasons. And you don't want to be whitening your teeth all the time, because it can damage your enamel. You can use something simple. This is something I got at the store, at the 99-cent store. It's just hydrogen peroxide. You can add a little peroxide to your toothbrush, or you can put it in one of these dental trays where you stick it into your mouth for a few minutes. That helps the whitening, and it's not going to damage your enamel over the long term. The main thing you want to be careful for is dark drinks like coffee or tea. A lot of people drink this stuff. This changes the color of your teeth. So if you can avoid that, you won't have to be whitening in the first place. Now, that's easy to say because a lot of people like to drink coffee and tea and stuff like that. Well, you can use a straw. not plastic, because you don't want to get plastic in your body, especially with hot drinks. But use like a metal straw. You can drink it, so it's not going onto your teeth. That's a good option if you drink coffee and tea, so your teeth don't get brown or gray. One last thing, what about if you have crooked teeth? Well, talk to an orthodontist about that one. But a lot of people are just using these trays now, where you just have multiple trays you put into your mouth, and you don't have to use the braces that actually shorten your roots. So you can look into that, talk to your orthodontist. But in general, in your mouth, you want to use things that are natural, just because of the proclivity for things to get absorbed and go into your brain and the rest of your body. So avoid dyes, perfumes, and fluoride. So hope that helps. If you have any questions, please comment below. From Los Angeles, California, this is Dr. Ernesto Martinez. Thank you very much, and goodbye.